How are very large ovarian cysts treated for fertility patients? When it comes to very large ovarian cysts in women trying to conceive, the main goal is to remove the cyst while keeping the ovaries healthy enough to support fertility. Usually, surgery is the best option, especially if the cyst is causing symptoms, growing quickly, or looks suspicious for cancer. The most common surgical approach is called laparoscopic cystectomy. This minimally invasive procedure uses small incisions and special tools to carefully remove the cyst, aiming to preserve as much healthy ovarian tissue as possible. This method often leads to quicker recovery and less trauma compared to open surgery, which might be needed if the cyst is extremely large or if there are concerns about malignancy. Surgeons experienced in fertility preservation use precise techniques to minimize damage to the ovary and reduce the chance of scar tissue forming, which can affect future fertility. If only one ovary is affected and removed, the other ovary can usually still produce hormones and eggs, although fertility might be slightly impacted. In rare cases where cancer is suspected or confirmed, both ovaries might need to be removed, which would mean exploring assisted reproductive options like egg donation. Before surgery, doctors typically perform ultrasound scans to evaluate the cyst's size, structure, and blood flow, along with blood tests such as Ca1-5 to check for signs of cancer. If the cyst looks benign, the surgical team plans the procedure to maximize ovarian preservation. For cysts that are small or functional and not causing symptoms, doctors might recommend watchful waiting with regular ultrasounds, as many cysts resolve on their own. Hormonal treatments like birth control pills can sometimes prevent new cyst formation but are not usually effective for large cysts needing urgent removal. After surgery, many women see improvements in fertility, especially if the cyst was blocking ovulation or disrupting hormonal balance. Recovery times vary, but most women can return to normal activities within a few weeks to months, depending on the extent of the surgery. It's important to discuss your fertility goals with your doctor beforehand so they can tailor the surgical approach to your needs. Surgery does carry risks, including damage to healthy ovarian tissue, formation of scar tissue, and potential reduction in ovarian reserve. Prompt removal of large cysts is crucial to prevent complications like ovarian torsion, which is when the ovary twists and cuts off blood supply, or cyst rupture, both of which can threaten fertility. In cases of endometriosis or chocolate cysts caused by endometriosis, specialized surgical techniques are used to minimize damage to the ovarian reserve. Overall, the goal is to remove the cyst effectively while preserving as much ovarian function as possible. Always consult with a fertility specialist or gynecologic surgeon to develop a personalized plan that considers your unique situation and future reproductive plans.